Hey, how was it so far?
No pain.
Let's see what kind of difference we have here.
Wow. I've never seen a jawline like that.
Yeah?
That's amazing.
Hey Julia, how you doing? So I'm Dr. Sue, and Julia is our returning patient. We just did a follow-up video for arms. She had the celebrity arms done, but we're doing her chin today. So she graciously volunteered to let us video this, and we're going to video the chin. We've already put in a little bit of numbing fluid here. We didn't put in very much, so it's still pretty close to the size initially. But anyways, you can come this way. And so, anyways, we're going to get a nice sharp chin, neck and chin line. Hopefully it'll be like a 90-degree angle, and we're going to try to get as much definition around her jawline as possible, because that's, having a very defined jawline, getting a little bit of fat will actually make someone look a lot more attractive. You want to have a nice separation of the neck and the jaw. Okay, so anyways, I just want to do a little intro here. How's the numbing part, Julie?
It's working. My mouth feels weird.
Okay. Was it very stingy when we put in the numbing?
A little bit, but it wasn't that bad.
Okay. And do you mind if we talk about what we've tried there in the past?
No, yeah, not at all. So, kind of similarly with my arms, I actually got Kybella and Cool Sculpting done, and did not work. So this is just something I've kind of struggled with my whole life. I know, like, I have a little bit of a weak chin, so I kind of had a double chin my whole life. And after I got my arms done and saw the amazing result, I figured I definitely just wanted to get this taken care of before I tried anything else.
Okay. Well, you wanted to try anything else. We'll have the maximum sharpness of your neck and jaw that you could have with anything once we're done with this. So anyways, Kybella, I say because in my experience, and I've done some Kybella type stuff as mesotherapy 15 years ago when I started, it makes some difference, but if you're really looking to get the most results, don't mess around with Kybella. I mean, you may see a little bit of improvement, but it's probably less than half of what a good liposuction can do. And that goes for any body area. The chin is probably the most common area that Kybella is used in, but I've seen it tried in I've seen other doctors use it in other body areas too, and it has even less effect. So anyways, once you spend the money on 2 Kybella treatments, you probably would have already spent the amount that
Exactly, that's what I was going to say.
It would cost for, just getting lipo done. Okay, and Cool Sculpting, kind of the same thing. All right, we'll come back after and show you guys the results. So for the audience out there, we just started doing the lipo, and Julia is wide awake. How you doing, Julia? Good. Good? Okay. Is it hurting? Can you feel anything? Okay. The neck and chin is a small area, but it's a finesse area. You really gotta get it completely for a lot of people, because there's not a whole lot of fat in some people like Julia, and if you don't get it completely, you're not gonna see much of a difference. And I know this looks kind of scary, but it's very controlled. It helps to have her wide awake. I have you, for the audience, I have Julia holding her neck and back in an arched position right now, so it's steady, it's not wobbling around on me. Right, Julia? Off. Off.
Oh.
And I'll just give you guys a little bit of a peek as we go. You can already see it starting to scoop out a little bit here. All right. Okay, I'll turn you down a little bit right here. Okay, arch it. Arch your back. Good, right there. Hold it. On. Is that okay, Julia?
Mm-hmm.
Good. Off. Yeah, doing lipo is all about control. It's not a suction procedure as much as it really is a scraping procedure. And so when we're underneath the skin right there, we're having to put some pressure against the fat, and the little holes are actually scraping the fat and breaking it free. The suction just allows the fat to be removed once it's broken free. Okay, we're gonna arch back here. Good. On. So you'll see me pinching and pressing and lifting things up, and that's to create the pressure on the fat so that we can break it free from its connections. Even cut. There it is. Okay, so for the audience out there, we've already worked this side, probably as much as I can. So you can see a little bit of her jawline, I believe, from that angle. Can you? And I'm gonna, okay, so we'll go ahead and do a little bit more. Okay, arch your back. Arch your back and neck. Still awake, Julia? Mm-hmm. Okay. Some people ask me, how do you avoid hitting, important structures? Well, the pressure is always outward. You can see my cannula thing always lifting up against the skin, scraping the fat outward toward the skin, not pushing down against the structures below. So that's kind of how we stay safe and we don't injure anything below it. What I'm doing with my fingers right here is I'm pinching up the fat. I'm grabbing everything I can and lifting it up, so I'm having a little bit of a roll here. Not much there, you got to get it all. So this is all about the control, like we said earlier. And this is where Julia has had some treatments with Kybella and cool sculpting, both of which cause injury to the tissue, and that injury is intended to kill the fat, but what it does is often makes that fat stronger. It causes some scarring in the fibrous connective tissue that's holding the fat. So then as we try to go in there and do lipo, we're fighting against the scar tissue, and she has I guess a moderate amount right there. It's not going to stop us, but it can certainly make things more difficult. You probably see that her chin's getting pretty sharp. I don't know from that angle, but I can tell it's getting pretty sharp already. Jawline right here is starting to show. We're going to reveal as much of this as we can. I think we're okay with this thing. Hold it tight, Julie. Good. She's doing quite a bit too. She's holding her whole upper body tense. She's arching her back a little bit, which is giving her neck some really nice solidness to it, so it's not moving around. That's what I need to do the best job that I can for her. We call this interactive lipo. I do my part, the patient does theirs. It's not just them going to sleep. Okay, relax. You can see that little sharpness there? Okay, hey Julie, turn this way. Hey, how was it so far?
No pain.
No
Not
pain.
at all. It's
Okay.
so easy.
Our audience, we just finished, so turn your head back straight up. I'm just going to show them. Okay, so hopefully you can see the difference. I'm going to have her, Julie sit up. Why don't you sit up right here? And I'm just going to show you. Okay, that's a pretty sharp jawline. Come on, let's go in front of the mirror. Let's see what kind of difference we have here.
Gosh. Wow. I've never seen a jawline like that.
Yeah? Okay.
That's amazing. I love it. Wow.
Let's see, let's just bring it to a normal level. Okay, you're going to get to see this. You're going to see it makes your chin look like you have another ½ inch of projection. Okay, so let's turn slowly around so that everyone can see. Go and turn this way. Okay, and then tilt it down just slightly. So even tilted down, she looks beautiful. Okay, yeah, go ahead. Yeah, you can look in the mirror. So, is that the change that you were hoping to see?
Yes.
That's more change than I was thinking.
I've never seen in my entire life had not a double chin. Oh my gosh.
I don't even know if you're going to need any kind of, projection,
Wow.
You know, we talked about maybe a little bit, you can get a little projection on the tip of the chin with using some fillers these days, but when we talked about that.
And I would prefer this, yeah.
But actually, I don't even know that you need it.
I was so happy.
Here, hey, Essence, would you bring her the mirror? Okay, so she's going to give you that mirror so you can see things from the side view, okay?
Oh my gosh. Wow.
Can you see how chiseled it looks now?
That's
and
amazing.
how much longer it looks?
Wow. I love it.
Okay, awesome. So your mouth is numb?
Yeah.
Feel like you've been to the dentist?
Yeah, I'm having a hard time talking, but.
Okay. All right. So anyways, you want to say goodbye?
Thank you so much.
Sure.
And if you're thinking about coming to Dr. Sue, he's an artist. He sculpts is amazing, and that really is the difference.
Okay.
So,
Thank you so much, Julia. Okay, bye-bye.
Thank you.